Hello and welcome to our video on considering anesthetics for patients who have a history of renal diseases. The metabolism and excretion of anesthetics and other medications used during anesthesia are significantly influenced by the kidneys. It is crucial to take extra care to ensure safe and effective anesthesia during surgical procedures because patients with a history of renal diseases may be at an elevated risk of anesthesia-related complications. The difficulties in handling anesthesia in patients with a history of renal diseases are covered in this video, along with the best methods for preoperative evaluation, intraoperative management, and postoperative recovery. Preoperative evaluation. Prior to any surgical operation, it is essential to perform a complete preoperative evaluation of the patient's renal function. Examining the patient's medical history, current medicines, and laboratory results like serum creatinine and estimated glomerular filtration rate are part of this process. eGFR. Any underlying renal disease or other comorbidities that may impact renal function and anesthesia administration must be found. Intraoperative management. When choosing and administering anesthetics and other medications during the surgical process, the anesthesiologist must take the patient's renal function into account. In individuals with renal illness, some medications may be contraindicated or require dosage adjustments. It may also be essential to monitor renal function while under anesthesia, and the anesthesiologist may employ strategies like goal-directed fluid therapy to enhance renal perfusion and function. Recovery following surgery. After the operation, managing kidney function is still a key factor to take into account. Renal disease patients may be more susceptible to postoperative problems like acute kidney injury or a slower return of renal function. Monitoring renal function is crucial, and any problems must be handled quickly. In conclusion, it is important to take extra care and precaution when managing anesthesia in individuals who have a history of renal disease. The risk of complications can be reduced while still providing patients with safe and effective anesthesia with the help of an appropriate preoperative evaluation, intraoperative management, and postoperative recovery. We appreciate you viewing and hope you learned something from and were able to use this video. Thanks for watching.